This is evidence-based practice in manual therapy, Module 2. It's the first part, defining the research question. And at the end of this session, we hope that you will be able to frame patient scenarios related to your practice and turn them into clinical questions, and define and apply the components of PICO questions. So think about the 5 steps of evidence-based practice, and we are interested this time in framing patient scenarios into a clinical question. And part B of this module will look at finding, systematically retrieving the best evidence available. So these are the steps of acquiring evidence, and the first one is defining your question using the PICO approach. Module 2 will go through, B will go through selecting the appropriate information sources, choosing databases, applying key terms, and modifying your search strategy. So one of the essential elements in evidence-based practice is defining answerable clinical questions. And in manual therapy clinical practice, questions about the best care for clients arise frequently. And given that the evidence is changing at a rapid rate, it is difficult to go to standard textbooks for the most up-to-date information. So it's unlikely that you could answer some of your questions about your patients using textbooks accurately and quickly. But with the access to information and technology, it's much easier now to respond to challenges by learning to use some basic search strategies and defining questions that are easier to answer. So when we translate a clinical problem into an answerable, focused, and well-formulated question, we spend less time looking for the right literature. So first, you would be looking for, PICO stands for patient population, intervention or index test, comparison or control, outcome, and a lot of times there's a T for PICO, and it's referring to the time element that's involved. So evidence-based practice always starts and ends with the patient. As you talked about a little bit in Module 1, it's not just about the research evidence, it's also about what the patient contributes to your understanding of the clinical issue and also your expertise and judgment. So there's there are 3 key elements, I think, to defining a clinical question. It should be of interest to you. It should be important to your clients' outcomes and well-being. And it should be something that you are likely to encounter often in your practice related to clinical scenarios. So maybe you have a cluster of patients with a particular diagnosis, or there's a new intervention that you're going to try. You've heard from other people that it seems to be working, but you want to look at the evidence to support it. And a lot of times the questions are about treatment interventions. So first, when you're defining a clinical question, you have to be specific, or else you'll be looking at a lot of literature. So is it young people, adults, elderly? What's their main concern or diagnosis? Is there an age group or some key prognostic factor that you're interested in addressing? And this will help narrow your search down. Although most of the questions that you'll come up with are going to be related to your manual therapy practice, as instructors you may also have educational questions, and we can talk about that later. So when you're defining the clinical question and you're looking at the intervention, as I said, a lot of times, I think for therapists, it is the actual intervention or treatment approach that you're going to use related to manual therapy. But it could also be something related to specific diagnosis tests, or whether or not you should use a product, an orthotic device, or an electrotherapeutic agent, and if there's a prognostic factor, and we'll have some examples of these types of clinical questions. So when you're defining a clinical question, I find in therapy a lot of times there isn't a comparison group in the actual study intervention. Um, so, but it would be an alternative, and a lot of times, because of the ethical issues related to withholding treatment or just the logistics of it, people may use exercise alone as a comparison, or say something like traditional or regular therapy. Hopefully, they define it. Because typically we do not withhold interventions. An exception might be in a drug trial where there's a high risk involved and the drug has not been tested at all. So in the initial studies, but I mean in physiotherapy, it's very unusual to have a comparison group that is withholding all treatment. But it, as I say, it might be wait and see, or it might be regular exercise. When we're defining the research question, we also look at O, the outcome, and it specifies the results of what you plan to accomplish, improve, or affect, and should be measurable. So it might be where you're eliminating symptoms such as pain, or improving function such as walking, or improving or maintaining quality of life. For example, reducing anxiety so the person can participate in a sport. And finally, T, the time. This is not always identified in the research question, but it's good for you to think about if it's short term or long term when you're considering an intervention that you're going to be researching. So, an example of a question that I would call an intervention is what is the effect of targeted manual therapy, for example, mobilizations or soft tissue release, and exercise on pain and function with adults, for adults with chronic lumbar pain compared to exercise treatment alone. So, you can see in this intervention question, there is actually a comparison group, and it's the exercise alone. So, as I said, there are different types of questions that you'll come across and that you might want to think about for your patients. So, don't think that it has to be an intervention trial. It can also be something looking at prognosis, differential diagnosis. It can be looking at harm or risk, etiology, and prevention. I will say that in terms of causation, which is etiology, and prevention, they are very difficult studies to do. And it's because there can be a correlation between um, two things. For example, diabetes and obesity, there's a strong correlation. But does um, obesity cause diabetes? That's more difficult to prove. And it would be the same in manual therapy. Prevention is difficult. Like if we looked at a falls prevention program, for example, very difficult to prove whether it's effective because of you're looking for events to happen then. So there are ways to look at that type of question, and we'll talk about those later. So some examples of a diagnostic and symptom prevalence question, and you can read these. What's the accuracy of a positive ULTT in detecting radial nerve involvement in adults presenting with lateral elbow pain? In terms of prevalence, what's the prevalence of pain and dysfunction in the cervical spine in female computer operators with and without lateral elbow pain? And you can see how specific that is related to the different components of the PICO question that we were talking about. They don't have the T in there, but they do have the type of the population of interest. They have the intervention, well, not an intervention for this type of question, but they have the outcomes that they're looking for as well. And then in the treatment selection and effectiveness, this is where you would see more of an emphasis on the intervention. But again, they do have adults with elbow pain. They identify the population. And there's a symptom prevalence question. Prognosis affecting the likelihood of success. Again, difficult, although there are studies, because there's so many confounding variables. with this sort of thing, in terms of determining what is the factor that plays the biggest role or is the most responsible for an outcome. So how do you answer clinical questions? We're going to go to the second part of Module 2, which will be based more on search strategies. Before we go to that, though, in the last slide, there is a table, which if you print it out, you can see it as a slide, you can see it a little better. And it does have question types and definitions and the template for PICO. And we'll be doing some PICO development of questions on the discussion board.